Hi, this is Dr. Susan Julius. I'm the Regional Medical Director of Avenues Recovery of Louisiana. And today we're here to talk about why does your face get red when you drink alcohol? Or why is it that people who drink alcohol for years and years and years have red faces? All right, First, let me teach you about how alcohol is metabolized in the body. Alcohol is metabolized by the liver. That's why if you drink like crazy, you can wind up hurting your liver. So alcohol has to be metabolized, and it is metabolized in two steps. And to break down substances, the liver secretes enzymes. Enzymes are a chemical that speeds up a reaction, and you have to have certain enzymes to do certain things. In the first step, alcohol is broken down into acetaldehyde. And then the second step takes acetaldehyde and breaks it down to acetate and water. What happens in some people, they have a genetic SNP or single nucleotide polymorphism or a genetic change that doesn't allow them to do the second step in changing acetaldehyde to water and acetate. And that's called the ALDH2 gene. And if you can't break down acetaldehyde to water and acetate, acetaldehyde is not fun in the body. Your body doesn't like it. It causes facial flushing, warmth, redness, elevated blood pressure. And it's kind of like a sign to tell you, hey, my body doesn't like this. They usually will have a drink or two, get real red in the face and get sick and not feel well. And a lot of them never go on to drink again because of it, because the alcohol makes them feel terrible. The other part we were going to talk about today is why do people with who chronically drink have signs of redness in the face or dilated veins in the face? And those are called telangiectasias. And you'll often see it on the chest or in the face of people who drink for years. And the reason is the liver becomes damaged with long-term drinking. The liver cells turn into fatty cells, and then after that, they become scarred and hardened and called and fibrotic, which is the term for the classic term is cirrhosis. When the liver does not metabolize well, it gets congested, and the blood pressure or the pressure inside the liver goes up. They call that portal hypertension. When the blood pressure goes up in the liver, it kind of backs up the plumbing, and so the blood pressure goes up in the veins, in all of the system leading toward the liver. So if you work backwards, that means the veins in the esophagus get dilated, and those are called esophageal varices. And it's risky because if a person vomits from drinking too much, those varices are very tender and they can be ripped, and the person can have an upper GI bleed. And that's how many people with alcoholic cirrhosis die, unfortunately. But if you keep backing up that pressure, the pressure gets dilated in the blood veins of the chest and then the face. So one of the classic telltales, and one of the reasons I can look at a person that comes in our door, if they're a drinker or not, is a reddened face. The other sign we call is rhinophyma, or an enlarged nose. So the moral of the story today is stay away from alcohol, because if you have a lack of ALDH2, you're not going to be able to break alcohol down into acetate and water and get rid of it, and you'll be sick. Interestingly enough, scientists use that as a way to try to stop people from drinking alcohol, and the medication is actually called disulfiram or antabuse. Antabuse literally stops the second reaction of breaking down acetaldehyde, so acetaldehyde accumulates and the patient or the person actually gets terribly sick, and drinking alcohol can be dangerous for them. And we do prescribe this here at Avenues. So some of you may wonder, man, this happens to me every time I drink and my face gets red. And is there a way to prevent it or do something or drink something different? And the answer is no. You genetically inherited a deficiency in the enzyme that breaks down acetaldehyde. So the answer to that would be to avoid alcohol. So there are potentially other medical illnesses that can cause a reddened face. One of the examples is rosacea. Rosacea is more of a skin disease that can be treated with antibiotics and creams, and it's more patchy and rash-oriented. And I would ask you to seek medical professional opinion if you're having problems like this. So thanks for learning with me today about why alcohol can cause a red face, or why people who drink for years have dilated veins in their face and a reddened face. Remember, you're not alone out there. If you or a family member are having issues with misusing a substance or a behavior that is causing problems in your life, we have wonderful resources at our website, and you can always pick up the phone and call us. Thanks for listening today.